I'm 68 years old and had a facelift 10 years ago. My face has drooped since then, and I'd like to know what my options are. I had what was called the quick lift and was very pleased, but as you can see, I could use something done. Please give me a few options.
Thank you for your question. You're 68 years old. You had a quick facelift approximately 10 years ago, and you said you had very good results and that you're ready for something else, and you submitted two photos that are certainly helpful. Well, it's great that you had a very nice result. You know, the quick recovery facelifts had a role and still have a role, and unfortunately have gotten a bad rap because too many people who weren't good candidates have had this type of procedure and weren't happy with the results. But that being said, you're clearly experiencing what is just natural facial aging. So at this point, it is probably more likely that you're not going to be able to get the same type of procedure. The quick lift that you had is a short scar facelift. It's a limited opening, and it takes advantage of certain physical aspects to the face and the soft tissue that descends, called the SMAS, or superficial musculoaponeurotic system. But as we get older, especially in the neck area, the skin tends to hang more. So the procedure that we would probably recommend, and this still requires a physical exam, is some type of face and neck lift. Now what does that mean? Well, a face and neck lift is, as described, elevating the face as well as the neck well below the area that a limited scar facelift can do. When we describe the incision, it involves going from the temple area down behind the opening of the ear, and then behind the ear in the crease and back into the hairline. It's very important to move skin. Now, whether it's a deep plane facelift, whether it's a SMAS flap, whether it's a high SMAS, or any other variation, experienced cosmetic surgeons know that we have to customize the procedure to the patient. And the older one gets and the more skin there is, there's no getting around it. We have to trim and tailor the skin. In our practice, we do these procedures under local anesthesia with light sedation. So that's one of the big advantages of this. You know, the original appeal of the short scar facelifts was that there was no general anesthesia. Now, of course, I had been doing full regular facelift without general anesthesia, you know, for close to 20 years. So I always thought that was interesting, but because it wasn't very popular at the time, people really gravitated towards the short scar quick recovery lifts. In a situation like yours, we would do this under local anesthesia with light sedation, but it would be a longer operation. The quick lift type of procedure, and anything in the same class, is usually a 1-hour procedure, somewhere around a 1 hour to usually an hour and a half. A full face and neck lift is more in the 2.5 to 3 hour range. But like any good facelift, it can last. It can last 5 to 10 years. It depends a lot on the individual's unique skin quality, texture, and as well as their tissue quality. Everyone gets lifted and is nice and toned and looks natural. There's an artistry, of course, to this. But then there is also a certain amount of elasticity and regression. So just to define the things that matter most to you when you communicate with your doctor is critically important in making this decision. So again, in summary, you're ready for another lift. It's going to have to be most likely a more extensive lift, but I think you have to meet with several doctors who perform more extensive lifts and not people who are limited to short scar lifts. This is one of the reasons why there was such a backlash, is that when a surgeon who can do a more extensive procedure makes a decision to do a quick lift, it's because it's the right choice for that patient. But if someone doesn't have that range, then they'll try to do the same procedure on everybody. So this was one of the problems that a very well-known national chain encountered when they tried to do like 7 of these surgeries a day, which is absolutely overwhelming for any doctor to try to accomplish as an individual under local anesthesia. So, and that's why this company had to go under and has dealt with a lot of litigation. So find a doctor. I guess the bottom line is find a doctor you trust, find someone who is committed to quality and who will be there for you beyond the procedure, and just be comfortable with that approach. And my personal bias is I prefer local anesthesia with sedation. I think it's just so much safer, and it does allow for a quicker recovery. So you get the best of both worlds. You get a more extensive procedure, and you get better recovery and less likelihood of complications. So I hope that was helpful. I wish you the best of luck, and thank you for your question.